So typically, when people with major depressive disorders are presenting with depressive symptoms, this is when your physicians may prescribe you antidepressants like SSRIs. SSRIs stand for selective serotonin reuptake inhibitors, and it's a class of antidepressants that we use to treat people with major depressive disorders. There is a theory that the depressive symptoms are coming from a low level of serotonin in the brain. And what SSRIs do is increase the level of serotonin in the brain, and hopefully that helps address some of the depressive symptoms. When the antidepressants are no longer or not showing the appropriate response at the appropriate dosage and duration is when your physicians may ask to change to a different class of antidepressants. A different class of antidepressants is SNRIs, and that stands for serotonin and norepinephrine reuptake inhibitors. And that class of medication work pretty similarly to the SSRIs in the sense that they also try to modulate and increase the level of norepinephrine. So for some people, SSRIs work just fine, and for other people, they may need a different neuroreceptors and neurotransmitters in the brain, and that's when a different class like SNRIs might come in. Atypicals are another class of antidepressant where they generally work in a different atypical way than the traditional SSRIs. Some of them may work on different neurotransmitters in the brain. Some of the less common classes of antidepressants that we may use is tricyclics or TCA, or monoamine oxidase inhibitors or MAOIs, and other modalities of treatments we might consider in the treatment course may be using ECT, electroconvulsive therapy, or TMS, transcranial magnetic stimulations, or some of the more novel and rapid-acting treatments, such as esketamine and neural-acting steroids. It's important to talk to your provider when you feel like your antidepressant is not working for you, because the whole goal of this is to make sure that your medical condition, your depression, is appropriately treated. If you or your loved one is having thoughts of self-harm or suicide, please reach out for help. Call the Suicide and Crisis Lifeline at 988 or go to your nearest emergency department.